Hey guys. All right, we're going to talk about exercise for people that are overweight and obese. So I'm going to go ahead and jump in and share this screen and run through this stuff as thoroughly as necessary, but as quickly as possible for you guys. So I really hope that you're watching these. I'm going to try to get a little feedback shortly to see if you are or not, or if I'm just wasting my time with this. So anyway, let's pull up the PowerPoint and just get rolling. All right, let's talk about exercise for individuals with cardiovascular disease. Major components of the cardiovascular system. As you know, the first one is blood, which is composed of plasma and formed elements. You need to know that those are the pieces of blood. The red blood cells, their purpose is to transport oxygen to our body cells. White blood cells provide specific and non-specific resistance, as it says here. They actually help to fight off pathogens and things in our bodies. You know, when we're getting sick, our white blood cells play a role in trying to fight off sickness and such. That's why if you go in and have a blood count done and your white cells are high, that tells them that your body is fighting something that shouldn't be there. Your platelets, they deal with clotting. They form platelet plugs, which end up helping areas where you have cuts, etc., to clot. The heart is another major component of the cardiovascular system, obviously. It creates the pressure to drive the blood through the vessels. It's the pump that pumps everything around where it needs to go. The right side pumps the blood that is low in oxygen to the lungs, while the left side pumps the blood that's high in oxygen out into the system to deliver oxygen where it needs to go for your body to function as well as possible. This is just a view, an anterior view of the heart. Interesting picture to kind of give you an idea. I won't make you label this on a test or anything, no worries. This is a more internalized view. You can spend more time on this if you like by going back to the PowerPoint and running through this yourself. It's got just about everything is labeled on here. Notice that the red and blue sections do show where there is deoxygenated blood and oxygenated blood. Another component of the cardiovascular system is our blood vessels. They're the conduits for blood. They are the tubes that our blood are carried in, the hoses that the blood uses to get around the body. The blood vessels include arteries, arterioles, which are smaller arteries, capillaries, veins, and venules, which are smaller veins. Capillaries are kind of the smallest. They branch out. You think of a river that branches out on a map in a lot of different directions. That's kind of how capillaries work in the body. Here's a diagram of superficial and deep veins, and also of the arteries in the body. This isn't every single thing, and again, I won't ask you to label this or anything, but it shows you how the blood gets where it needs to go and comes back from where it has been. Artery, one way to remember, artery carries blood away. Since it's taking blood away from the heart, it is oxygenated blood that's going out to the body. Veins bring blood back to be reoxygenated. So the functions of the cardiovascular system are to ensure adequate distribution of oxygenated blood throughout the body. Obviously, that's the key. And another big thing, it delivers waste products to excretory organs such as the kidneys, the lungs, and the skin for removal. We need to release carbon dioxide. Our kidneys need to produce urine to get rid of things that we don't need anymore. So it helps the cardiovascular system, not only deals with distributing oxygen, but it also helps our bodies to rid themselves of waste. Risk factors, characteristics or behaviors that increase the likelihood of disease development. That's what a risk factor is. And there's a couple different things here, and you need to know this. There is non-modifiable risk factors and modifiable risk factors. Modifiable risks are things that we can change, such as extreme alcohol use is a risk factor for damaging our liver. Smoking cigarettes is a risk factor for lung damage, etc. Things such as advanced age, that's a non-modifiable risk factor. You can't change your age. You know, if you become more prone to cardiovascular issues, osteoporosis and things as you age, you cannot change that. You can't change your age. So that is non-modifiable or not changeable. Know the difference there. Non-modifiable risk factors are things such as age, sex, or family history. You can't change your family history. Believe me, if you could, I would probably change some of my family history, but that's a different story. Modifiable risk factors are things like cigarette smoking. If you have high blood pressure that's unchecked, you need to be medicated, possibly lose weight, increase activity level to get hypertension under control. High blood cholesterol, that can also be done through medication, weight loss, exercise. If you're obese or overweight, that is a modifiable risk factor. You can lose weight. High blood LDL levels, that's the bad type of cholesterol. High homocysteine, C-reactive protein, and fibrinogen levels. We'll talk a little bit more about what that means later. Homocysteine, that's an amino acid that's formed from the breakdown of methionine. It doesn't really accumulate much because it's converted into cysteine or back into methionine. Some people don't have the enzyme that converts this. The problem with homocysteine, and this is what you need to know, homocysteine can damage arteries. It promotes cholesterol buildup, partially because when it damages the arteries, basically what it does is make little barbs on the inside of your arteries. That makes your arteries more prone to catch cholesterol and have it build up on itself. If the artery walls are smooth, you won't have as much of this happening. Also, homocysteine interferes with clotting factors of the blood. So by lowering homocysteine levels that have enzyme deficiency, it decreases your cardiovascular disease risk. That's important. C-reactive protein, that's a plasma protein that shows inflammation. Levels rise of this protein in response to inflammation resulting from coronary artery disease, cancer, infection, trauma. C-reactive protein levels basically independently predict the risk for heart attack. So you don't want your levels to be predicting heart attack, obviously. You want your lowers you want to lower this if it is a high number. Fibrinogen, here's the point on fibrinogen. It's a plasma protein. It has to do with blood clotting. It makes blood more viscous or kind of thicker. If you think of motor oil or, maple syrup, it's thicker than water. You want your blood to be thin enough that it can flow through your veins and arteries easier. Your heart doesn't have to pump as hard. When blood becomes thicker, more viscous, it interferes with your blood flow. Your heart has to work harder to push a thicker fluid through the area, and it promotes excessive platelet clumping. So maybe some clots could be an issue that you could run into. These are the ways listed here, table 7.4, that you can reduce fibrinogen levels: quitting smoking, exercise, eating a healthy diet, low in saturated fat, high in fruits and vegetables. Reducing stress can even reduce fibrinogen levels, you need to know these as well. Increase your intake of omega-3 fatty acids. That's an important thing to note. And take a low dose of aspirin each day. These will cut down on fibrinogen levels, thus making your blood thinner, for lack of a better way to put it, and easier to run through your system. Your heart won't have to work as hard. There won't be as much pressure on your veins and arteries, from the fluid that's going through there. So let's talk about cholesterol. It's a type of lipid or fat classified as a sterol. It's needed by the body to build cell membranes. So cholesterol in and of itself is not a bad thing. It's used also to form certain hormones. It's produced by the liver at a rate of 800 to 1500 milligrams a day. That's way more than you would consume in the average diet. So the liver actually puts out cholesterol. Lipoproteins, they transport other lipids through the body. They include chylomicrons, VLDL, or very low density lipoprotein, LDL, low density lipoprotein, and HDL, high density lipoprotein. These are the portions of cholesterol that we'll talk about more in depth. Chylomicrons, not as important as the others to me. They're large lipoproteins. They transport triglycerides throughout the body. They're removed from circulation by the liver when they become depleted. VLDL, very low density lipoprotein. Know what this is? It transports triglycerides and cholesterol through the body. So the difference here, you need to note what it transports: triglycerides and cholesterol through the body. It eventually loses the triglycerides and eventually just turns into LDL. So the triglycerides are basically what makes it very low density lipoprotein. Once the triglycerides fall off, it's just low density lipoprotein. LDL, here we go, just said it 3 times. LDL transports cholesterol to the body cells, which is not necessarily a bad thing. It often, LDL is kind of sloppy. When it's going around the body trying to deliver cholesterol, it needs to pay more attention and hold on to it. But instead, it's kind of like the bag that it's carrying it in has a hole in it. And you've got a little cholesterol dropping out and accumulating on your artery walls. So that's why you want, when you get a cholesterol count, you don't want your LDL to be an extremely high number. The higher that number is, the more chance you have of accumulation on your artery walls. HDL is high density lipoprotein. What it does, it's kind of the good guy. It comes in and transport the cholesterol that was lost by the LDL back to the liver. So it's picking up after LDL. It cleans up after LDL. So you want this number to be high. The higher, kind of the better on this one. This is just a diagram showing types of lipoproteins. Again, I won't make you do anything with these pictures, but they're interesting. Especially, I want you to look at this atherosclerosis, which shows you about the consequence of high cholesterol. When it's cholesterol's normal, the walls stay smooth and clear. When the level of cholesterol becomes elevated, you start to have LDL form plaque in the arteries, and you see how it would block blood flow coming through right here. Eventually, you can have up to 100% blockage, and that's when you start running into heart attacks and strokes and things like that. Think how much harder the heart would have to pump blood through this lower picture than it would through the upper picture. A wide open tube versus a C-shaped opening at the top of the tube. Big difference. A lot more stress on your cardiovascular system. Some diseases of the cardiovascular system: atherosclerosis, coronary artery disease, unstable angina, that is chest pain basically, heart attack, hypertension, stroke, peripheral vascular disease, that's where you start to have disease of the veins and arteries that are away from the heart or center of the body out in your arms, legs, distal areas, and congestive heart failure is another. Atherosclerosis, we showed you a picture of that just a minute ago. Fatty deposits start to accumulate on the inner side of the arterial walls. Many times there's chronic inflammation that comes along with that. And because of this buildup, the arterial walls end up being weakened. So that is a problem as well. And here's structures of blood vessel walls. From the heart is the red/orange side here. You're looking at arteries to the heart to go back through and be reoxygenated to be sent out are the veins. They're made a little differently, look a little differently. Just interesting pictures. Here's a very, very good picture of atherosclerosis from normal to just a small fatty streak, then a fibrous plaque, and then a complicated plaque. You see, as it starts getting bigger and bigger, obviously that's more complicated. Coronary artery disease, a lot of times it's referred to CAD, affects coronary arteries, which supply the heart with blood. So that is very important group of arteries. Sometimes it's indicated by angina pectoris, stable or unstable. That is, again, just remember, angina is chest pain. Heart attacks, know the real name for a heart attack. It's a myocardial infarction. It's going to result when a portion of the heart gets deprived of oxygen for long enough that cells begin to die. And this can be caused from several things: a coronary artery blockage, severe coronary artery spasm, where the artery actually just like tenses up and won't let blood through. And coronary microvascular dysfunction is another possible reason for a heart attack. Here it shows the common signs and symptoms: angina pectoris, uncomfortable tightness, squeezing, pressure, or fullness felt at the center of the chest. It can be intermittent. It typically subsides when activity ceases. There's also pain into the arms, back, neck, jaw, shortness of breath, cold sweat, nausea, vomiting, or lightheadedness. Those are all common signs and symptoms of heart attack. It would be good if you knew those, where if you saw this happening in someone, you might be able to recognize what's going on, get them help quicker, realize the severity. Hypertension, that's just high blood pressure. That's defined as a blood pressure of higher than 140/90. Most doctors want to keep you closer to 120/80. The problem with hypertension, as it says here, it's known as a silent disease. A lot of people, most of you guys probably don't have a blood pressure cuff or machine where you can take your blood pressure on a regular basis. Most people don't. And, you'll go to the doctor and have high blood pressure, and they're like, well, when's the last time you had your blood pressure, took your blood pressure? And your answer is, well, it's the last time you took it. So, a lot of times you don't feel a whole lot different or anything. So just something to keep in mind, it increases the risk for kidney disease, peripheral vascular disease, and congestive heart failure. You guys need to come back and watch this YouTube video. Just go through the slideshow that's in the content area and watch this. I'm not going to do it during this part because I'm just going to go ahead and try to knock this thing out for you guys. Your blood pressure is going to vary on several different things: how hard the heart is contracting, the strength of that contraction, what demands are being placed on the heart, your blood volume. The more blood volume, the harder it is to push the blood around. The arterial wall elasticity and recoil, that has something to do with it too. If you think of something that's elastic, think about a waistband of some pants that are pretty tight on you. Elastic makes it feel better. The pressure is less. Same thing goes with your arteries. if they're able to stretch and recoil, that's kind of a healthy arterial wall. Once that starts to go away, you're going to start having blood pressure increase because of lack of elasticity. Blood flow resistance, either caused by atherosclerosis, something like that. Blood viscosity, if your blood is thicker than normal, it's going to raise your blood pressure. If it's super thin, it may help your blood pressure to go lower. And just your general overall health is another thing that plays into this. Two different types of hypertension. Secondary hypertension is not as common, but there's a definite identifiable cause like kidney disease, a certain disorder like adrenal gland disorder, or medications. A lot of cold medications that you can take. The ones that they have locked up behind the counter now that have like ephedrine in them that people make meth from. Those are the ones that can cause secondary hypertension. They run up your blood pressure. You need to know the difference in these for test time. Essential hypertension is there's no real obvious cause, although this next sentence it's almost silly to me. It's associated with cigarette use, excess weight, sedentary lifestyle, excess sodium, older age, excess alcohol use, and heredity, which all of those things to me would be obvious causes of hypertension. But we're talking about there's not kidney disease, something wrong with your adrenal gland, or a medication that's driving it up. It's something that happens more from everyday activities that we deal with, or things like having excess weight and being sedentary. Essential is more common, and it does not have that definite identifiable cause as in secondary hypertension. That's the difference. Strokes, what's happening there is when part of the brain gets deprived of oxygen. There's two different types. You need to know these and know the differences. You have an ischemic stroke, which is caused by atherosclerosis of major vessels that supply the brain tissue. So they basically are clogged up with fat. And then there's a hemorrhagic stroke, which is caused when a major vessel that supplies the brain tissue actually bursts, which that can be caused by having atherosclerosis, because when that buildup ends up weakening the arterial walls, and you could have bursting of the vessel. But when that happens, it's hemorrhagic. Ischemic is caused by atherosclerosis. Stroke, the brain is deprived of oxygen. These are the signs. This is another thing that's be good for you to know these symptoms and be able to recognize this and help someone get medical assistance quickly. Numbness or weakness of the face, arm, or leg. A lot of times it's even just like one side. Sudden loss of sensation, confusion, trouble speaking, having trouble understanding other people, sudden difficulty seeing, sudden difficulty with walking, sudden dizziness, loss of balance, loss of coordination, or a severe headache that comes on suddenly. Those are all signs of a stroke. Peripheral vascular disease, that's another one that we talked about. This is any disorder that affects blood vessels found outside of the brain and heart. So we're talking about just not right here. It usually results from atherosclerosis. Usually, more often than not, it affects arteries, not veins. The major symptom, if it's present, is cramping or unusual fatigue of the legs and buttocks, which is very odd to me. But most of the time, this is the major symptom of peripheral vascular disease. Should be able to remember that. Congestive heart failure, that comes usually later in life. It's the inability of the heart to adequately pump blood throughout the body. It's caused by coronary artery disease. It can be from extensive scar tissue from a previous heart attack. You know, we said when you have a heart attack, you have damage to the heart muscle. Hypertension can cause it due to, just the amount of stress that's been placed on the heart. Valve disease in the heart or valve infection can cause this. And it could even be a congenital heart defect. that, you know, you're born with that can lead to congestive heart failure. When we're talking about working with people who have any of these issues, we got to realize that if they're aware of what's going on, they're going to probably be on medications. A lot of medications have side effects. So when we're dealing with patients, we need to know what sort of medications they have and what the side effects may be. Some other things that are common with cardiovascular issues like these are shortness of breath, chest pains, exercise-induced ischemia, and high blood pressure. So we got to watch out for these items when you're going to do exercise with them. Now, here we go again back into, so what are the benefits of exercise for people in this special population? Number one, you can increase their maximum oxygen uptake. They can bring in more oxygen more efficiently. Improved heart functioning, reduced angina, that tightness, pain in the chest. Improved health of the blood vessels. Their blood lipid profile will be better, which means your HDL number will be higher, LDL will be lower in comparison to inappropriate numbers. Improved recovery from heart attack. It helped to rebuild, you know, yourself back up from that scenario. Improved mood, reduced anxiety. A lot of times when someone has had a heart attack, a stroke, know that they have high blood pressure and things, they're going to have anxiety, and you know that's going to affect your mood. So we all know that exercise helps our mood, helps to reduce anxiety. So that's a positive for almost every group that we're talking about this whole semester. Also, you'll see improved insulin sensitivity, which means that blood sugar levels will become more normalized, and a reduced risk of death, which is always a plus. You know, if you can do that, I think it's worth doing. I think I went one too far. Okay, if someone is diagnosed with cardiovascular disease, they need to have a stress test prior to exercise, you know, to doing something relatively high intensity, especially. Testing needs to be done by a physician, nurse, exercise physiologist, a physical therapist, and medical technician. There's a lot of different types testing that can be done, but most of the time we won't be doing this testing ourselves. It should be done prior to them coming to us to work on physical fitness. So their contraindications are things that say, uh-oh, we got a problem here, basically. And there are absolute and relative contraindications for most of these scenarios. So contraindications here are in reference to exercise according to guidelines that have been given to us. Absolute contraindications mean you do not do this when this is going on. Absolutely not. Relative contraindications mean you better keep a close eye on somebody with this scenario. So just remember, absolute means no, it's a no-go. Relative means it's, you know, iffy, but you could still do it, but you need to really watch what's going on. Some absolute contraindication, if someone had a heart attack within the past 2 days, well, they're probably not going to be in the mood to just jump up and do a lot of exercise. Unstable angina, which is, you know, chest pain that is not able to be really controlled. Cardiac arrhythmias that are uncontrolled. Aortic stenosis, uncontrolled symptomatic heart failure, acute myocarditis, or pericarditis. Those are all listed there. Now, on the relative, the ones on the left side, you do not exercise if they have this going on. However, things like electrolyte imbalances, you know, give them a Gatorade, keep a close eye on them. Severe arterial hypertension. You know, exercise if done properly with these people, can help to bring, in the long term, hypertension to a better level. So you would just need to keep an eye on someone who has severe arterial hypertension. Tachyarrhythmias or bradyarrhythmias, which are just arrhythmias where the heart beats either too fast or too slow. You need to watch those people closely also. Mental or physical impairment that interferes with ability to exercise, that could be the case in someone who had had a stroke, perhaps. Those are on the relative contraindication side. So here's an example of the exercise prescription. Step 1, they're going to go through a cardiac rehab program in a clinical setting. This is one setting where you can work with an exercise science degree. It's closely administered by medical personnel, reestablishes functional capacity. We were finding out where they need to be, where they are, what's their new functional capacity after their heart attack, stroke, etc. Step 2, independent exercise following physician guidelines. And this is safe when cardiac symptoms are stable or absent. They're not getting worse. You may have some slight symptoms, or you may have none at all. And if that's the case, then you're free to independently exercise following the guidelines of your physician. So here's just some ACSM guidelines for outpatient programs. Excuse me. As far as cardiovascular exercise, we're looking at you want to proceed all activity with a 5 to 10 minute warm-up. That's generally about the norm. Maximum exercise intensity of 12 to 16 on a 6 to 20 Borg scale. That's pretty high. If you're up toward the 16 end, you're working them pretty hard. Progress to a duration of 20 to 60 minutes per session, 3 to 5 days a week. So we're talking cardio here. Encourage activities like walking, biking, stair climbing, ellipticals, rowing machines, but remember to progress slowly. You don't want to push them so hard that they're going to have another episode or injury from this. Resistance exercise is safe as long as the clients have no sign of congenital heart failure. Uncontrolled dysrhythmias, or heart rhythms that are uncontrolled and out of whack. Severe valvular disease, that's a hard word to say, you should try it. Heart valves, if they have disease and are having difficulties with that. Uncontrolled hypertension, that's not safe. And unstable symptoms. You don't really know what's going on at a given moment. With resistance exercise, you want to use elastic bands, 1 to 2 pound hand weights, 1 to 5 pound free weights, cables or resistance machines, training 2 to 3 times a week, give at least 48 hours of rest in between, do 2 to 4 sets of 8 to 10 exercises targeting major muscle groups, give them a resistance that allows 10 to 15 reps with RPE, rating of perceived exertion. That's going to be 11 to 13 on a 20-point scale. So they're working pretty hard, not over the top hard. If you're working so hard that you start holding your breath, that's a bad thing. That will run your blood pressure up in a heartbeat. For people with CHF, congestive heart failure, cardiovascular exercise, they need to get physician clearance. They need a little longer warm up and cool down. Their heart needs more time to adapt both ways. You want to encourage non-impact activities like stationary cycling, things, even running, jogging is impact, your feet. You want to get them, an elliptical would be a good choice. They're not actually having any impact with that either. Initial training duration for people with congestive heart failure, 10 to 20 minutes with 2 to 6 minute exercise intervals followed by 1 to 2 minutes of rest. You want to build your way up to 30 minutes of activity. So that's something different with this group. You go for 6 minutes, give 1 to 2 minutes of rest, then go for 6 minutes. The intensity needs to be at an RPE, rating of perceived exertion, again, of 11 to 14. And obviously, you're going to stop if the exercise, if pain in the extremities occurs or heart palpitations start to occur. Good reasons. As far as resistance exercise for people with congestive heart failure, it's safe for most people. You don't want to do isometric contractions, that means the change of your muscle length does not occur. That would be like me putting my hands together and pressing as hard as I can. Neither one is going to move, yet my muscles are contracting. That would be like pushing against a wall that's not going to move. Your muscles will not change in length. So you're doing isometric contractions. You don't want to do that for people with congestive heart failure. You also don't want to hold your breath. This is called the Valsalva maneuver. That's dangerous for people. And that happens when you're trying to overdo it. Like if you see people a lot of times trying to do a max rep on bench press, you'll see them turn beet red because they hold their breath when they're trying to press that up. You do not want to hold your breath when you're exercising. Absolutely dangerous. People with hypertension, they just need to get medical clearance if their blood pressure is not controlled. The physician is going to say whether they'll determine the necessity for exercise testing. A medically supervised symptom-limited exercise test might be indicated, where they need to see them exercise and not show negative symptoms to be able to be cleared. With them, as far as, again, I'm not going to test you on these times. I'm not going to ask you what percent of VO2 reserve we're going to be talking about. But these are things that you can keep and put in your toolbox to take with you and use later. You want to warm up for 10 minutes. This is for people with hypertension again. Progress slowly. Exercise on most, if not all days of the week at a moderate intensity. We're talking about a rating of perceived exertion, 12 to 13. You need to do at least 30 minutes of continuous or intermittent activity is what you're shooting for. As far as resistance exercise, it's not really recommended as the major form of exercise for people with hypertension. You want to do it in conjunction with cardiovascular training. Do resistance work with light weights and higher reps. That's the safest. Higher weight of lower reps is going to be more prone to raise blood pressure. You want to do this 2 to 3 days a week, 60 to 70% of one repetition max, going up to 80%. Include 2 to 4 sets of 8 to 12 reps of 8 to 10 group different exercises that targets basically all the major muscle groups. So you can still do resistance with people with hypertension. You just have to be more careful. People with peripheral artery disease, PAD, warm up and cool down needs to be at least 5 to 10 minutes. Walking is really the most effective mode for this group. Needs to be done 3 to 5 times a week at a moderate intensity, 40 to 59% of VO2 reserve. Exercise should initially be intermittent in nature. You working up to 30 to 45 minutes of continuous exercise, progressing to 60 minutes. Resistance training can be done on at least 2 non-consecutive days a week. 60 to 80% of one repetition max is safe. Complete 2 to 3 sets of 8 to 12 reps. So you can work pretty hard on that. Sample exercise program. It says here that cardiac patients benefit the most from cardiovascular training. So you want to emphasize aerobic activities like walking, biking, and rowing. Resistance training is a safe adjunct or addition to cardiovascular training. The next section is going to show you some possible resistance exercises. These are just some samples. Rows using an elastic band, chest flies with elastic band, front shoulder raises with elastic tubing, hammer curls with light dumbbells. You see what we've got here is a lot of things saying elastic tubing, light dumbbells. You're not going to be doing resistance exercise to the point that it's going to make you start wanting to hold your breath. Also, if you're really, really straining and flexing, you're actually putting more pressure on a lot of your arteries and veins because your muscles are pressing against them. And if you're already talking about blood flow issues, you could run into more trouble because of that. You've also got some resistance exercises down here that just use body weight. You know, you're talking with lunges and abdominal crunches. You're not even adding anything, but you are dealing with resistance and gravity. As far as nutritional considerations, we're coming up on the end of this, guys, so thank you for hanging in there if you have. Saturated fats, obviously, those are kind of your bad fats. They increase the risk for heart disease. They're found in fatty meats, whole fat dairy products, and tropical oils. Try almond milk. I love almond milk. Substitute leaner cuts of meat. You know, chicken is leaner than pork. Low or no fat dairy. You know, fish is a good option most of the time. Trans fats, they increase the risk for heart disease. They're found in crackers, donuts, cookies, fried foods, all the things that you can look at that name right there. You're talking tons of carbs, trans fat, unhealthy, weight gain. You want to limit your intake of those things. We're talking about cardiovascular issues here. So obviously taking things that are going to increase risk for heart disease are taking in those items are not a good idea. Cholesterol, need to keep it under 300 milligrams a day. Limit proteins that are high in cholesterol, such as eggs, and that stinks because I love eggs. Meat and chicken, those are all high in cholesterol. Salt, it causes a problem for salt-sensitive people. They've got 2,300 milligrams as the top end of milligrams of salt you should take in a day. Best options are to use fresh, frozen, canned foods without added salt. Limit the intake of salty products and processed foods. Where, you know, this is common sense stuff, guys. Adequate intake levels are 1,500 milligrams from 19 to 50 years, 1,300 milligrams from 51 to 70 years, and 1,200 once you're over 70 years. So the amount of salt that you should be taking in needs to lower as you get older in age. There's some debate about whether salt really causes much issue to the body or not, whether it raises blood pressure and things like that. And there's been studies done that have actually shown it both ways, but this is pretty standard procedure type information that's on this slide here, so it's something you can pretty much go by. Energy intake, that is what you eat. When you eat, you are intaking energy, calories. You want moderate energy intake to encourage weight loss, because in most cases of cardiovascular issues, most, not all, you're going to need weight loss to help with the situation. Weight gain has been a lot of the cause. Weight loss improves blood pressure, the workload of the heart, circulation of blood through the body, and your blood lipid profile, which is your cholesterol count. Something else that helps, fiber, is something that we don't think about, and I would just about guarantee you guys don't think much about fiber. When you get older, when you get to be an old man like me, you'll think more about your fiber intake. Just kidding, I don't really have a lot of issue with anything dealing with fiber, but as far as women, they need 25 grams a day. If they're less than 50, can drop to 21 grams a day if they're over 50. Men, 38 grams a day if less than 50, and drop to 30 grams a day if they're over 50. Adequate fiber, how it helps, it reduces risk for heart disease and stroke, binds dietary cholesterol, which keeps the body from absorbing it, which can help get your cholesterol count in check. It binds cholesterol in bile, preventing that reabsorption. That's how it works. Monounsaturated fats, they're found in olive oil, canola oil, peanuts, avocados. We're talking about fats that are good. I'm on a diet right now, and avocados are one of my staples. They're full of fat, but they're good fat. They improve your cardiovascular risk by lowering total cholesterol and LDL levels without lowering your HDL levels, which that's awesome. Decreasing triglycerides. It prevents oxidation of your LDL. It gives you phytochemicals that you need, and you do see reductions in blood pressure from this. Another thing that's good that you can introduce to your body is omega-3 fatty acids. They reduce triglycerides in the blood, prevent blood clots, help prevent against those dysrhythmias or heart rhythm difficulties. They help lower your blood pressure and limits inflammation. And where you find these omega-3s are fish, flax seeds, and some different nuts. Women need to have 1.6 grams a day. Men need to have 1.6 grams a day. Women need to have about 1.1 grams per day. I know we're not measuring those things, and you don't need to, but know that omega-3s are beneficial and should be something that you would include in your diet. Fruits and vegetables, they're packed with antioxidants, which are things that fight off mutations in the body, kind of. Antioxidants are kind of anti-cancer specialists, is what I think of when I think antioxidants. They also contain phytochemicals, which are things that help your body to be healthy as well. Additional dietary considerations. Soy. This one really is covering a lot of dietary issues because these cardiovascular issues are really tied into obesity a lot of times. So that's the thing that you really have to get in mind when you're thinking about this. With soy, the plant sterols are going to decrease risk for cardiovascular disease. 2 grams of plant sterols per day can lower your LDL levels by 6% to 16% without affecting HDL levels. So soy lowers LDL if your cholesterol levels are out of whack the wrong way. That's one way to help address it. As far as alcohol, no more than 1 drink a day for women and 2 drinks a day for men reduces risks of heart disease. Only benefits men that are older than 45 and women older than 55. So alcohol can actually help with cardiovascular issues. That's what we're talking about here. But you need to be within the level that we just said. Now this stuff is important and you need to remember this slide. No more than 1 drink a day for women, as that's shown as being beneficial. And 2 drinks per day for men have shown to be beneficial in reducing the risk for heart disease. Hey, we finally got something that says to drink. Again, it's only benefits have been shown for men that are older than 45, so we can start drinking earlier and drink twice as much, and women older than 55. And how it works, it lowers total blood cholesterol, increases HDL, which is your good cholesterol, and minimizes inflammation, blood clotting, and atherosclerosis. Red wine is a good option. I know heart doctors that have told patients to drink a glass of wine every day. That's one option I know for sure. However, red wine has a lot of sugar in it. It would raise your triglycerides perhaps, which is something else that may be looked at. So there's pros and cons to almost everything in life. Folate, vitamin B12, and vitamin B6. They reduce your risk for cardiovascular disease by reducing blood homocysteine levels. We talked about that early in the slideshow. If you do not remember this, go back and look. Obtain adequate amounts of this generally through your diet is the best way to get it. You can also pick up things through supplements. The best way to get it is through eating a rounded diet. Antioxidants, what they do is limit free radical damage. We talked about these a little bit already. Antioxidants include vitamin C, vitamin E, and selenium. And here is the recommended intake. for these. I'm not going to even ask you this or run through these. Vitamin C is good for us. One thing to note, if you're a smoker, whether male or female, they tell you to up your vitamin C by 35 milligrams a day. So you're trying to cut down on the detriment of smoking by adding 35 milligrams a day of vitamin C. So there's a couple different programs we'll talk about, and then we'll have this wrapped up. There is a lifestyle change program. It's brought forth by the National Cholesterol Education Program. It's called the Therapeutic Lifestyle Changes. And what it is, it's a program designed to reduce coronary artery disease prevalence and incidence by addressing blood cholesterol. So TLC addresses blood cholesterol, and you need to remember that. TLC focuses on the diet, your physical activity, and your weight management. That's how it works to address blood cholesterol. Therapeutic lifestyle changes that deal with addressing blood cholesterol. Remember that. You need to know what TLC is, that it has to do with cholesterol. How it works is you limit saturated fat intake to less than 7% of your total caloric intake. Limit your total fat to 25 to 35% of your total intake. Consume less than 200 milligrams of cholesterol a day. Lose weight if necessary. Add 5 to 10 grams of fiber to the diet. We've said how that keeps from LDL being absorbed. Add 2 grams of plant sterols to the diet, and accumulate at least 30 minutes of moderate intensity activity each day. We talked about how each one of those can help with cholesterol, and this just puts it into a specific program that will help speed up the process by keeping you on track. DASH diet. You need to know what the DASH diet is. It is a dietary approach to stop hypertension, DASH. DASH has to do with high blood pressure or hypertension. It significantly lowers blood pressure in those with hypertension and pre-hypertension. There's 2 plans. One of those limits sodium to 1,500 milligrams a day. One limits it to 2,300 milligrams per day. And here is the diet recommendations for the DASH diet. We're talking about high blood pressure. Fat needs to be 27%. I'm not going to run through each one of these here. I'm not going to test you on it. But you need to know that the DASH diet has to do with hypertension. TLC has to do with cholesterol. All right. Pretty good chapter. A lot of information. Seemed really long to me. Hope you guys hung in there. Really hope you're watching these things. Otherwise, I'm talking to myself a lot for no reason. So I will be posting the next lesson relatively soon, hopefully tomorrow. So you guys have a good one. Talk to you later.